let's have a think about movement patterns. And I've got a few images that are going to help us. I may rely on a few other examples as well, but somehow I thought these might be useful. I want to first of all talk to you about movement at hinge joints. Okay, so let's just put a heading up here of movement. Oh, my handwriting. At hinge joints. Now, this first example I'm going to give here is of the, I'm going to use here both the knee and the elbow. Now, don't be fooled into thinking these are the only hinge joints. They are not. But we're going to talk here about the knee and the elbow. So we'll focus on these, okay? So we've got some nice examples to do so. So let's focus on knee first of all. What are we looking at? Well, first of all, if we further break this down, let me break this down further with a different colour. The knee can perform two movement patterns, obviously, as a result of muscular contraction. It can undertake flexion and it can undertake extension. And let me be crystal clear, guys, that is all. That is all this hinge joint can do, okay? So let's have a look at this. Let's focus on the knee. If we have a look at this position here, okay, this knee is in a flexed or a flexion position. This one here is in extension or extended. We've got flexion here, different color required there. We've got flexion here, for example, all right? So when we talk about flexion, we are talking about that sort of bending of the knee. And this is achieved with the agonist of the hamstring group, okay? So the hamstrings do that job. Extension with our gymnast, for example, the straightening, this is achieved by our quadricep group. Remember, these are groups of muscles, not individual muscles. You'll come back to that in future study, I'm sure. Now, with the elbow, we're going to do exactly the same thing. We're going to break this elbow down into two movement patterns. And guess what? They are flexion. What's going on with my pen? And they are extension. I haven't left myself enough room, so squeeze it in. There we go, just about. Extension. So similar ideas here, guys. Now, in this example up here, we've got flexion occurring. In this example, we've got extension. Here, difficult to tell, but I think if anything, it's sort of in between, okay? Now, what I'm going to say here is that flexion, the bending of the elbow, the agonist for that, or the prime mover, is the bicep, okay, the bicep. And extension is achieved by, not surprisingly, the tricep. So if you think about it from the perspective of this performer here, in the extended position, this tricep muscle is the muscle which is straight in the arm. Now, we should say that arm is going to remain locked at the elbow. It's actually an isometric contraction, of course. So that's actually the balancing of both muscles. But generally, extension, the movement of extension is achieved by the tricep. Now, without me losing my images too much, just go down slightly here. Hopefully I can still get them in. I now want to talk about movement of ball and socket joints. So let's put in here movement at B and S, ball and socket joints, okay? So what are we talking about here? Well, this is a slightly different picture. First of all, I'm going to talk about two examples. I'm going to talk about the shoulder. I'm going to talk about the hip, and the movement patterns are effectively shared amongst these, obviously with different contributors. So first of all, let's focus on the shoulder. The shoulder really is capable of four primary movement patterns, okay? Four primary movement patterns. So let's do it in yellow. So let me just break this into, that was meant to be yellow. Let me break this into one, let's put as 2, 3, 4 primary movement patterns. So the first one I want you to be aware of, or the first two, I want you to be aware of at the shoulder, flexion and extension. So let's have a look at this, please. This performer here, this slant performer, has her arm in front of her body here. This is flexion at that shoulder, okay? Flexion at that shoulder, all right? Same here, we have the arm out in front. As this person kind of swings their legs through here, which I'm assuming they're doing, their arms, so their body's going to come into this position here, okay? Their arms are going to be behind their body. That is extension at the shoulder, the arm being behind, like reaching behind you in a relay type action, trying to grab the baton if you're the person at the front. That is what we mean there. The second group of movements we want to be aware of are abduction, and adduction. Okay, abduction and adduction. Now with abduction, what we're talking about here is the arm is moving away from the midline. So let's focus on adduction. If we look at this performer here, his midline of the body is there. Can you see that his arms are nice and close to that midline? That is because those arms are adducted. If the arm was to come here, 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 this would be abduction. Think about someone, for example, performing a star jump as an example, or someone in a cartwheel position. Okay, those are abducted shoulders. Now the hip, we get exactly the same. In fact, I tell you what, with the hip, we get exactly the same. I wonder if I can actually do this. If I copy this, copy paste, I think I can actually get the same thing. It's not going to quite fit in. It's going to go off the side. But we get exactly the same from the hip. Okay, so if I was to drag you across, you'd actually see exactly the same. And it works exactly the same. So for example, just to stress this, flexion at the hip is, for example, here. This person's got their hip flexed because it's in front of them. This hip is flexed. This hip is flexed, for example. This one's in a neutral position. If it was to go back behind you, it would be extended. Again, abduction, adduction is taken away from the midline, sort of that cartwheel position. Adduction is bring it back in. Now, two final points on our ball and socket joints that I just want to make to you. Let me just scroll down a little bit. You should also be aware of what we refer to with ball and socket joints as rotation. Rotation is the rotation of the actual lever arm in the joint. So if you put your arm out in front of you, for example, at the shoulder, and you sort of rotate the entirety of your humerus, that is rotation. Okay, now that tends to happen in things like, we might have it in things like spin bowling in cricket, for example. Okay, spin bowling where you sort of twist that arm. Now, we also, if you get flexion and add it to extension and abduction and adduction, this is what we refer to as circumduction. Circumduction. Now, if I come back to my bowling example, this could be an example of all of those combined would be overarm bowling. You're effectively circling the entire shoulder by following these four movement patterns, okay? And that produces for us circumduction. Now, I've read in different places, some people don't consider circumduction to be an actual movement pattern, but a combination of others, whereas rotation very much is, okay? So just bear that one in mind. But rotation is the actual pivoting of the bone within the joint, whereas circumduction is the combination of these movements.